Before we start our presentation, this is our poster.
Assalamualaikum and hi everyone. We are from AM38 4G Group 4 and our group's topic is Should Animal Testing Be Banned? I am Ham Aziati together with other members Anis Umairah, Nur Naimah, Nur Zafira and Nur Atasha. Animal testing is the practice of conducting unethical and frequently unpleasant experiments on animals held captive in stressful laboratory environments, typically in the mistaken belief that the results will be applied to humans. Animal testing is a contentious issue that has split people into groups, which are those who support it or oppose it completely and those who advocate for the use of alternatives.
Assalamualaikum, my name is Anis Umairah. This is the first main idea from the article that I have chosen. The first main idea is for pros on animal testing, which is animals make excellent research subject because they resemble humans in many ways. So why this main idea support animal testing? There are 4 supporting details to support the main idea. Firstly, experiments on animals are absolutely conclusive for the toxicological and hygiene of man. The effects of these drugs are the same on man as on animals, stated by Burnett. Claude Burnett are known as the prince of vivisectors and the father of physiology. He established animal experimentation as part of the standard scientific method since it is necessary to advance medical and biological knowledge. Secondly, the very first animal protection legislation was enacted by the British Parliament in 1822, followed by the Cruelty to Animals Act 1876, the first law precisely designed as a guidelines of safety for animal testing. And in the United States, Henry Bergh founded the American Society for the Prevention of Cruelty to Animals in the 1860s, and the American Anti-Vivisection Society was founded in 1883, so the animals are protected during animal testing, which added more reason to support animal testing. Moreover, insulin was initially extracted from dogs in 1922 and it changed diabetes medication, demonstrating that animal research has advanced to aid more people which founded by Pasteur. Lastly, supporters of animal research such as the British Royal Society stated that nearly every major discovery in the 20th century required the use of animals in some way, while the Institute for Laboratory Animal Research of the United States National Academy of Science highlighted that even advanced computers can model interaction between molecules, cells, tissues, organs, organisms, and the environment. Hence, the need for animal testing in many cases.
Hi, Assalamualaikum. I'm Nur Zafira. I will continue the presentation with the second pros or advantages of animal testing by 3 main dimensions whereby scientific quality, promise or potential outcome, and actual outcome. There are 4 supporting details for these pros. The first one is Happel et al. As cited in Bronsted et al. 2016, stressed that the use of animals over basic research as human substitutes has been accepted by science and society through regulation as an endeavor in veterinary medicine's human health improvement as well as advance in scientific knowledge. In some cases, such studies can be a benefit for the actual animals involved in the study by providing them with improved conditions to maintain good health and well-being, such as the impact of potential improvements in cancer therapy for a patient with cancer targeted by the therapy. According to Bronsted et al. 2016, animal experiments have benefits to the economy to increase efficiency in agriculture, but provide benefits to the economy if the experiments conducted are harmful to most animals. However, the economy can help farmers to reduce production costs and reduce pollution to the environment. These experiments directed to improve efficiency in agriculture then can have economic interest as the primary aim or benefit. Furthermore, the good name of organizational and outcome was developed by productive scientific aims or enriched career anticipations, gaining powers and consequently family prerequisite for individual scientists and their backstaff exigencies. According to a survey that conducted by Federation of European Laboratory Animal Science Associations, FELASA, 72% of people agree that the animal testing are give benefits for humans as in fundamental issues, while 40% disagree with it. Plus, Bronstein et al. Concurred that these experiments have helped to increase the researchers' knowledge and understanding of a phenomenon that occurs. We also can gain knowledge from these studies that may benefit the farmers and stakeholders involved in the farmer industry.
Next, for the third process of animal testing is about strategy of 3R that being worked on animal testing that stands for reduction, refinement and replacement. This 3R strategy is being introduced by Charles Hunt and William Russell mainly to reduce animal involvement in the lab, refine the animal mental health and replace as many as possible of animal in experiment. Animal is the main subject that will be used to test any kind of experiment to obtain the result that will similarly have the same impact on human. In reduction, statistical aids such as application of human hepatocyte culture to determine such inappropriate chemical of animal will be minimized. There are some drugs that will have unknown side effect on different types of animal and mostly all of them will die at the end. Next, for refinement, improving the animal facility and laboratory will be a lot of help in reducing animal distress, whereas imbalanced animal level of hormones will affect the result of the experiment. Providing the animals with a good cage environment and supply with the adequate food and drink needs for the animal. Animal also do have feelings that often ignored by human. So when the animal is stressed, it will decrease the quality of the research. Lastly, replacement process by using in vitro cell culture has been successfully done in certain countries. Cut out the skin irritancy test and raise eye irritancy test. Moreover, for diabetic patient, insulin extraction is now derived from bacterial culture rather than extracted from pancreas of pig and cow. Chromatography technique has successfully replaced the use of animal for checking the purity, efficiency, and calculation of dosage of drugs.
The following main idea is there are several alternative methods suggested to prevent the use of animals in experiments. Time efficiency, minimal manpower requirements, and cost effectiveness are all advantages connected with these alternative methods. To support the idea, according to Evedani, with the help of specialized computer models and software programs, can manufacture a new medicine for the specific binding site, as a computer can assist in the comprehension of numerous biological basic principles. For example, computer-aided drug design (CADD) software is used to anticipate a prospective drug molecule's receptor binding site and aims to discover potential binding sites, avoiding the use of compounds that have no biological action. Also, brings the advantages of computer models over conventional animal models are the speed and relatively inexpensive procedures. Referring to the study made by Dewhurst to compare the effectiveness of computer models to traditional laboratory procedures, it was discovered that experiments made by computer models had a more positive attitude about problem solving and were far less expensive than old laboratory practices. In vitro cell and tissue cultures, which entail the growth of cells outside of the body in a laboratory environment, can be a viable alternative to animal testing, as we know that almost all cosmetics, drugs, and chemicals are tested for their toxicity and efficacy. For example, the eye irritancy test uses the DRACE test, which requires animals, mainly rabbits, to check the irritancy of chemicals. It is very painful every time a new animal is used. According to Doak, some workers suggested an alternative that used bovine corneal organ culture that is cultured for up to 3 weeks in the laboratory, and various analytical methods are used to evaluate the toxicological effect of test chemical irritancy in vitro. Furthermore, the advantages of various types of tissue culturing procedures include being simple to follow, taking less time, and being less expensive. For example, fruit fly requires an extremely low cost of maintenance, propagation, and screening as compared to the other mammal-based models. As the adult fly is a very complex organism, its function of various structures like the heart, lungs, gut, kidney, and reproductive tract are equivalent to that mammals. The ethical issues have posed many restrictions on the experimental use of higher model vertebrates like guinea pigs, rats, dogs, monkey, and etc. As different model organisms are utilized to replace experimental animals, the use of alternative organisms has been recommended. For instance, animals in the laboratory are frequently replaced by invertebrate organisms. Parkinson's disease, endocrine and cognitive dysfunction, cell aging, diabetes, and toxicological testing have all been studied with them.
Animal testing not only has pros, but it also has cons. Bronstein et al. Identified different realms or sources that may hurt animals and which are pertinent to the deliberation of harm. Firstly, anti-vivisectionists and public opinions are concerned with the painful procedures that cause harm to animal experiments, but not only harm caused by pain, but also any aspect that can compromise animal well-being, including the opportunity to express normal behavior. There are some freedoms that animals do not get during the research were conducted on them, like freedom from hunger or thirst to maintain their health, freedom from discomfort by providing an appropriate environment including shelter and a comfortable resting area, freedom from pain, injury or diseases by prevention or rapid diagnosis and treatment, and also freedom of express normal behavior by providing sufficient space, proper facilities, and the company of the animal's own kind. Besides, these animals' experiments have caused several dangerous factors such as injuries and diseases and caused the animals to experience fear, anxiety, and distress. It is important to ensure the conditions and treatment are prepared for animals to avoid them from having mental suffering. In fact, 90% of people agree that animal testing gives harm to the animals based on survey on ethical evaluation in Finland. According to Porter, procedures that are performed frequently or take place over a long period of time will cause the lifespan of the animal to be shorter as it is by endangering the animals. If they are repeated frequently or the procedure lasts for a longer period or conducted over a substantial part of the animal cannot endure the pain, thus it makes the animal's antibodies weaken and die. Plus, a study conducted by Bronstein et al. 2016 found that the failure to consider natural values has been acknowledged as an impairment factor to animal experiments. Experimental approaches involving cumulative mild harm to many animals in lieu of more severe harm to a few animals create ethical dilemmas that warrant thoughtful analysis and resolution. So this is my points. Thank you.
Besides that, another cons which are stated on the poster is that animal testing is cruel and inhuman. Why I said so? This is because there are 4 supporting details that support the main idea. The first supporting details is that many people believe animals were incomparable to humans and that their outcomes could not be applicable to humans since they were so varied, which makes animal testing is a waste and only make animals suffer. According to the United States Department of Agriculture, approximately 420,000 were used in surgeries where sedation was given to reduce pain or discomfort, while 84,000 that were utilized in experiments which causes pain were not treated properly. Researchers emphasizes that animals do not feel the same pain and suffering as human beings because they lack of consciousness. Furthermore, according to Bernard Rollin, the lead author of 2 U.S. federal statutes governing animal pain relief, wrote that 37 researchers were uncertain whether animals sense pain until the 1980s, and the veterinarians training in the United States before 1989 were simply told to ignore animal pain. This clearly shows that animals have to face the consequences of testing that humans did on them. In addition, there are methods that researchers choose to do, considering that it does not cause death to be in pain or distress to the animal, such as made animals inhale gas which include carbon monoxide and carbon dioxide, beheading small rodents or rabbits, captive bolts that use on dogs, ruminants, horses, and electrocution for sheep, cattle, and foxes. This, in fact, shows us that animal testing is cruel and inhuman since they do not truly care for animals.
My name is Nur Naima. I'm going to explain the cons of should animal testing be banned. The cons is crucial challenge to combat the translational reliability as a lack of compatibility between animal models and human disease. Approaching the complexity of human disease in animal models will bring huge difficulty in reproducing anything as it will limit their usefulness as human disease is usually induced in animals. Inconsistencies between the animal's experimental model and the human condition probably will bring the translation of its result to the clinic will fail, even though the design and conduct of an animal experiment are sound and standardized. Inability to model human disease in animals and the poor predictability of animal models can lead to high clinical failure rate in drug development across all disease categories. Additionally, even after success in animals, around 172 and 150 drug development failure have been identified in treatment of human Alzheimer's disease and inflammatory disease respectively. The study also found that the human and animal results were in accordance only half of the time, like the animal experiment were no more likely than a flip of the coin to predict whether those interventions would benefit human. The failure rate keep increasing that now closer to 96% even though has effort to improve the predictability of animal testing. Another cons of should animal testing be banned is human clinical trials fail with the difference far outweighing the similarities among species along the subtle biological dimension. Misleading of animal testing results can harm human which is exposing patients to unnecessary risks and wasting scarce research resources, where unspecific results from animal experiments will lead to clinical trials of biological faulty or even harmful substance. Misleading in animal tests may be the indirect source of human suffering as will become the opportunities cost of abandoning promising drug. Treatment that fails to work or shows some adverse effect in animals because of species-specific influence may be abandoned in preclinical testing even if they have proved effective and safe in humans if allowed to continue through the drug development pipeline. Drugs that useful like aspirin and penicillin may not be viable today if the current animal testing regulatory requirements were in practice during their development to make sure it's safe to use by the humans. The use of invalid animal disease model that can bring potential of abandonment of useful treatment that will lead to researchers and industry in wrong research direction to wasting time and significant investment.
So this is our references and thanks for listening.